Nigeria Center for Disease Control (NCDC) confirms 16 new cases as total number of cases rise to 254. Federal government says there might be an extension of total lockdown. In international news, British Prime Minister Boris Johnson spent second night in intensive care unit. His condition is said to be stable. And later, sports. World Athletics suspends Olympic qualification dates.
This is ANN News.
I am Olajumoke Olatunji. The Federal Fire Service has successfully put out a fire that started in the office of the Accountant General of the Federation, Ahmed Idris. There is no confirmation about the cause of the fire. The building was recently renovated. Presently, most offices of the Federal Capital Territory are partially in operation. Civil servants from grade levels 1 to 12 were directed to stay at home as a measure to contain spread of the coronavirus. The Nigeria Center for Disease Control (NCDC) has confirmed 16 new cases of coronavirus and 1 death in the country. 10 of the new cases are in Lagos, 2 in the FCT, 2 in Oyo, 1 each in Delta and Katsina. As of last night, the tally stood at 254 confirmed COVID-19 cases. 44 patients have been discharged and 6 deaths have been recorded. 75 persons are in quarantine in Kwara State after having direct or indirect contact with the state index case. Among the 75 in self-isolation are 28 staff members of Ilorin Teaching Hospital who attended to the suspected coronavirus patients before his death last Thursday. Governor Abdulrahman Abdulrazak also confirmed the suspension of a senior consultant of the teaching hospital, Professor Alakija Salami, for his role in the admission and release of the corpse of a late suspected coronavirus patient. UITH Chief Medical Director, Professor Abdullah Yusuf, also confirmed that 28 staff members of the hospital are in self-isolation. The governor also signed into law a regulation to give legal backing to the government's measures to contain COVID-19 in the state. The federal government is yet to take a decision on whether to extend the 14 days restriction of movement imposed in some states over the coronavirus pandemic. Secretary to the government of the Federation, Boss Mustafa, says the president will evaluate the prevailing situation before deciding on what action to take. Boss Mustafa, who also chairs the Presidential Task Force on COVID-19, says his panel would assess the situation and give the president the advice that will enable him to take the appropriate decision on whether the restrictions. It is day 9 of President Buhari's directive on total lockdown in Lagos, Ogun, and the Federal Capital Territory. Experts had predicted those who would be affected are the food supply chain and consumers. Reporter Kelechi Emekalan tells us how the lockdown is presently affecting Nigeria's food production.
Fish farmer Joshua Ishaku has spent the past 13 years operating this business in the Nigerian capital, Abuja. He distributes his produce to major stores across the city. But Joshua's operation is being hobbled by the confinement order in the city. Disruption in production and supply, as well as inflation, are causing growing panic on food availability in the country.
The price of feed is already high in the market because people are afraid that prices will escalate. People are afraid that they will not be allowed to go out to do their normal businesses. Those who import feeds will not be able to import. Even the feeds that we do locally in Kwara State, you can hardly source for feeds from Kwara State down to Abuja because of this lockdown. So those people who were fortunate to have feeds in their stores will have to hike the price in order to take advantage of the situation, and that will tell on the farmer.
The Nigerian government's been making effort to diversify from its oil-dependent economy to focus on sectors like agriculture. A good move as the country's 200 million people translate to high demand for farm produce. The central bank rolled out 75 billion naira, just about $195 million intervention as loan to farmers. But many, like Joshua, are yet to benefit from it.
Some 8-10 years ago, I was introduced to a microfinance bank, and with the enthusiasm and zeal I had to grow the business, I was asked to pay 30% of 2 million naira that I needed to put into the farm. And you know, as it were, up till today, I have not gotten that loan that I paid for. It turned out to be a scam. I have not gotten any such intervention since I started farming business.
Now, food insecurity is a rising concern in Nigeria. Funding and infrastructure deficit remain major challenges. More so, Boko Haram's insurgency in the northeast has disrupted farming in the region. And without timely interventions to boost food production, no less than 7.7 million Nigerians may experience severe food shortage in the coming days.
Coming up, African stories. Chinese medical aid for 18 African nations arrives in Accra. And later, international news. British Prime Minister Boris Johnson spent second night in intensive care unit. Conditions said to be stable.
You are watching ANN.
Stories. China's medical aid for 18 African countries has arrived in Accra, Ghana, and are scheduled to be delivered to 17 other countries within a few days. The supplies were brought in by a chartered China air cargo plane. They include personal protective equipment, N95 face masks, medical protective suits, goggles, gloves, temporary artery thermometers, and ventilators. Ahmad Rafai reports.
A show of support in the fight against the coronavirus in Africa. Medical aid from the Chinese government has arrived at the Kotoka International Airport in Accra.
At this time around, the medical items are in short supply because of the great demand. Now, they are not available in the market if you would like to pay the double or triple prices. In face of these huge challenges, we have managed to procure the supplies and get them here in chartered aircraft when all the flights have come to halt.
The donation from China includes protective kits and ventilators. It comes as Ghana is stepping up testing of people who may have come into contact with those who had tested positive for the virus.
We are trying to expand the testing capacity to ensure that test results will not continue to delay any longer.
Health officials say the aid from China could help the country battle the virus.
17 other African countries will benefit from the aid from China, and Ghana will supervise the distribution of the protective equipment.
The United Nations World Food Programme and the United Nations Humanitarian Response Depot will also coordinate the distribution of the medical supplies across the West African countries.
Our hope is that the United Nations Humanitarian Response Depot in Ghana, which is entrusted with the distribution of the medical supplies to the other 17 beneficiary countries, would be able to do so in record time to assist those countries fight this pandemic.
Health officials say all frontline workers have to use the personal protective equipment as they work to contain the spread of COVID-19. The medical aid from China will be distributed across hospitals in Ghana and the rest of the West African countries.
Many African countries are ill prepared for COVID-19, but the snap has not begun to show because of low number of cases. Well, health workers in South Africa, where the largest number of confirmed COVID-19 cases has been reported, are crying out of dangers to their members because of a shortage of COVID-19 protective gear. Reporter Julius Shua has the story.
South Africa's doctors and nurses are preparing for the worst. As the number of COVID-19 cases surge, ventilators, protective suits, masks and gloves are becoming scarce and more expensive.
All the doctors are very keen to help, to get involved and to be on the front line, but we are not prepared to sacrifice our own safety. Surgical masks like the one I'm wearing have increased about 20-fold in price, from 1 Rand a unit to 20 Rand a unit. The fancy masks that we would like to wear, N95 or FFP2, have increased 10-fold in price.
We haven't as yet, as a country, run out, but there are provinces and facilities that definitely do not have equipment. So we are estimating that for every COVID-19 positive patient that is treated per day by a team of people, you would need something like 14 to 20 sets of personal protective equipment.
Personal protective equipment shortages and price hikes are leaving doctors, nurses and other frontline workers feeling vulnerable, and we need them healthy now more than ever.
I think we're just appealing for the general public and big businesses to help us with protective equipment, because it's quite hard as doctors to try and source it and do all the administrative jobs of trying to find people who'll sell it at a good price, and it's taking a lot of our time, frankly, which we don't have.
Civil society and businesses have responded to the call and stepped in.
We started a fundraising effort appealing to friends, family, businesses who we knew, and it was extraordinary. Bonnie from Heavenly Feathers stepped up and started making masks for us. We managed to raise $15,000 and we've been able to donate over 500 sets of scrubs and masks to various clinics and hospitals around Gauteng. So it's been incredible to see how people have responded.
The government is working with businesses to address the shortage, but it will have to work quickly to protect its frontline workers.
Uganda began fighting locust invasions in early February. Despite the almost $2 million it has thrown at the problem, new locust invasions looms and its food security is threatened. Reporter Hilary Ayisiga is in Kampala.
Hoppers continue to make their way into Uganda. This is the second invasion of locusts in a period of 3 months. Pest controllers are worried that the latest swarm could even be more destructive.
The new invasion is more scaring because unlike the previous one where they were very old and mature, having traveled all the way from Somalia, from Ethiopia, but this time we are scared that this could be younger, immature adults which are very feeding, and this being the beginning of the planting season, if we don't control them thoroughly, they can be a very big problem to the country. So that's why we are not taking any chances, and we have to ensure that whatever comes in is thoroughly controlled and beaten off.
Uganda has deployed the army to help control the locusts. They are using hand spray pumps and aerial spraying. They plan to boost these efforts with more aircraft.
We are trying to make more clearances to ensure that this aircraft comes in tomorrow and it boosts the ground control efforts which are being done by the UPDF. Because at times the UPDF has a limitation because these locusts tend to be high up in the bushes, and those are the types we shall be looking up when we are applying the aerial control method.
They have also put in place a mechanism to intercept swarms coming into Uganda. Pest controllers are hopeful that these measures can stop the plague.
When we return, international news. British Prime Minister Boris Johnson spent second night in intensive care unit, conditions said to be stable. And later, sports. World Athletics suspends Olympic qualification date.
You are watching ANN.
Somewhere in the world, every second of the day, news is happening. And of course, Nigeria is bustling with news day and night. That is why ANN doesn't sleep. Our eyes are peeled, wide open, so no story escapes our radar. We stay abreast of world events and happenings at home. We keep you up to the minute in the world of sports. We give you information to stay on top of your investments and all the hard facts you'll need to navigate your day. If you miss us on air, you can keep up to date on our website and on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. We are ANN, Africa News Network. We do news right in a truly African spirit.
Welcome back. This is ANN News. In international stories, British Prime Minister Boris Johnson has spent a second night in intensive care over coronavirus infection. Officials say his condition is stable. Foreign Secretary Dominic Raab said at a news press conference that Johnson is still in intensive care unit but is currently in stable condition, receiving conventional oxygen therapy. Raab promised Johnson and the British people that the Downing Street office will not flinch at this critical moment. He said they will stay strong in carrying out the government's plan to defeat the COVID-19 pandemic. Prime Minister Johnson tested positive for COVID-19 12 days ago and went into self-isolation at home. His Downing Street office said in a statement on Sunday that his condition did not improve after 10 days and that he was still suffering from a persistent coughing and fever. He was moved to intensive care on Monday afternoon after his symptoms worsened. Just like the United States and some other countries that are experiencing a high number of COVID-19 infections, the United Kingdom is experiencing a ventilator shortage. The country's manufacturers are jumping in the saddle to produce them. Reporter Natalie Powell has the details.
UK manufacturers say they are ready and waiting for the call-up from government to help the country build ventilators.
This is almost a bit like the wartime effort, where companies, Second World War, making one product one day and then asked to make Spitfires the following week. I think it's the same scenario. We can all do our part, we can all play our part.
Ventilators will help severely ill coronavirus patients to breathe, but they're in short supply in the country's publicly funded National Health Service. That's why consortiums of British industry are pooling resources from all areas, such as medical, aeronautical and construction. Even engineering firm Dyson, known for manufacturing vacuum cleaners, has pledged to make 10,000 of them. Assembly lines like these could be used to manufacture much-needed ventilators in the UK. There are currently 8,000 of them belonging to the NHS, and it's estimated around 30,000 life-saving ventilators could be needed in the coming months. As a subcontract manufacturer, PP Control and Automation makes products and parts for other companies, and with these skills and experience, it believes it's well placed to help.
We're very good at manufacturing things. We've got 220 people that work on this site. Most of those, about 180 in manufacturing. That's a lot of pair of hands that we could put towards this effort.
So whether it's building entire machines or simply parts that will go into ventilators, the race is on for manufacturers to plug the shortage. But there are likely to be major challenges ahead, not least because the industry is highly regulated. And the certification process, which can often take months, would need to be expedited to get these machines into hospitals where they're needed.
Spain has seen its total number of coronavirus infections rise by 5,500 cases between Monday and Tuesday. New numbers now have crossed the 140,000 mark. Spanish Ministry of Health, Consumer Affairs and Social Services said on Tuesday, total number of deaths has risen to nearly 14,000. This means the cumulative number of confirmed COVID-19 cases in Spain has surpassed that in Italy and all other European countries. The increase ends a 4-day consecutive decline in the new daily deaths in Spain. Medical officials at the Spanish Ministry for Health has attributed Tuesday's increase to delays in collating data over the weekend. The officials said pressure is slowly becoming as intensive care units as nearly 1/3 of patients from confirmed cases have recovered. The officials said social distancing played some role in containing the spread of the pandemic She said it was not clear what would happen if the measure is relaxed. Brazil was facing a medical supply shortage in its handling of the COVID-19 pandemic. Now, owners of 3D printers are trying to help reduce the shortage. Reporter Paulo Cabral has the story.
This is 3D printing in the age of the COVID-19 pandemic. These volunteers are producing face shields as a way to tackle the worldwide shortage of medical safety equipment against the coronavirus. The idea is the brainchild of this biomedical engineer who recently posted online calling on her peers and owners of 3D printers to help after seeing a similar initiative in Italy.
We are working on 3 different fronts. One front is to develop a platform to manage the project and distribute the products. Another is the production of the face shields themselves. And a third one is a project to use 3D printing to produce ventilators. We are just waiting for our design to be approved by health authorities to begin production.
A French multinational home improvement retailer offered its facilities, usually rented out to customers to practice do-it-yourself projects, now to volunteers to print and assemble equipment.
The health industry, by themselves, it's difficult to do all the things. So important, all the companies in different sectors join together to deal with this crisis.
The masks being made here are primarily destined to healthcare professionals. In many hospitals around Brazil, there is already a shortage of materials like this, essential for them to work safely.
In this 3D print workshop in São Paulo, more volunteers are working on face shields. One challenge now is collaboration.
We have managed to work in a decentralized and autonomous manner to fulfill society's needs. What we need now is to have more people who have 3D printers to contact us to get the file and begin printing as soon as possible.
The COVID-19 pandemic has brought huge challenges to the world, and many people are up to it any way they can.
Up next, sport. World Athletics suspend Olympic qualification dates. Please stay with us.
You are watching ANN.
Welcome back. This is ANN News in Sport. World Athletics has announced the suspension of the qualification period for the Tokyo 2020 Olympic Games until the end of November. This includes consultation with the Athletes Commission, area president and council. During this period, results achieved at any competition will not be considered for Tokyo 2020 entry standards or world rankings. Results will continue to be recorded for statistical purposes. If situation gets back to normal by then, the qualification period will resume on December the 1st and continues the new qualification deadline in 2021 set by the International Olympic Committee. U.S. prosecutors concluded, after what they call a lengthy investigation, that officials of World Football Governing Body FIFA were bribed before voting in favor of awarding Russia and Qatar the right to host the FIFA World Cup in 2018 and 2022 respectively. A 70-page document on the investigation reveals several FIFA former executive committee members were offered or actually accepted bribes in connection with their votes. The American prosecutors say there is an evidence of profiteering and bribery in international soccer, which they claim has been deep-seated and commonly known practices for decades. That is ANN News this evening. Thank you for joining us. For details on these and other stories, visit our website, annafrica.news. Conversation continues on our social media platforms, Twitter, Instagram, and Facebook at ANN Africa TV. I am Olajumoke Olatuji. Have a pleasant evening.